Most women don't know PCOS is not simply a problem with ovarian cysts. It is a complex hormonal and metabolic condition that can influence your periods, ovulation, skin, hair, blood sugar, fertility, and long-term health. You can even have PCOS without visible cysts. Today, you will learn what is actually happening inside your body, how insulin and androgen hormones become connected, which symptoms matter, how PCOS is diagnosed, and what treatment myths can delay proper care. My name is Dr. Chloe Anderson, and on this channel, I explain exactly what is happening inside your body, using science, 3D animation, and simple language that anyone can understand. In today's video, you will discover, number 1, what PCOS is and why its name can be misleading. Number 2, how androgens can disrupt follicle development and ovulation. Number 3, why insulin resistance can affect both metabolism and reproductive hormones. Number 4, which common PCOS myths are scientifically wrong. Number 5 practical steps for discussing symptoms, testing, and treatment. Let's get started. This video provides general education, not individual medical diagnosis or treatment. PCOS stands for polycystic ovary syndrome. A syndrome is a group of related features. It is not one identical disease experience. Symptoms vary widely between women. Some women notice irregular periods. Others first notice acne or unwanted hair growth. Some discover PCOS while investigating difficulty becoming pregnant. The name creates confusion. The small round structures often seen on ultrasound are usually immature ovarian follicles. A follicle is the fluid-filled structure where an egg develops. These are not automatically dangerous ovarian cysts. More importantly, visible follicles are not required in every diagnosis. Healthcare professionals usually look for a combination of key features. These may include irregular or absent ovulation, evidence of higher androgen activity, and a characteristic ovarian appearance on ultrasound. Other possible causes must also be considered. There is no single blood test that proves PCOS by itself. Your provider may review your cycle history, symptoms, medications, family history, physical signs, blood tests, and sometimes an ultrasound. Your body does not need to show every possible symptom. You can have PCOS at different body sizes. You can have regular-looking ovaries on one scan. You can also have polycystic-appearing ovaries without having the complete syndrome. This is why diagnosis requires the full clinical picture. Now let us follow what happens during ovulation. During a typical menstrual cycle, signals from your brain guide follicle development. Usually, one follicle becomes dominant. It matures and releases an egg. This is ovulation. After ovulation, progesterone helps support the uterine lining. With PCOS, higher androgen activity can interfere with this process. Androgens are often described as male hormones, but every woman's body naturally produces them too. The problem is not their existence. The problem is their amount or effect. When androgen activity is higher, follicles may stop developing normally. Ovulation may happen less often. It may also stop for extended periods. Without predictable ovulation, periods can become irregular, widely spaced, or absent. Some women experience unpredictable heavy bleeding when the uterine lining eventually sheds. Higher androgen activity can also contribute to acne, oily skin, increased facial or body hair, and thinning scalp hair. Imagine your cycle as an orchestra. Each hormone must enter at the right moment. PCOS does not simply turn the music off. It disrupts the timing between instruments. That is why two women with PCOS can look completely different. One may struggle mainly with irregular periods. Another may have acne and unwanted hair. Another may first seek help for fertility. But here is what many women are never shown. The ovaries may be responding to a signal coming from somewhere else in the body. Now, here is where it gets even more fascinating. Because what I am about to show you next, many women go years without understanding. PCOS can involve a feedback loop between insulin, blood sugar, and androgen hormones. That loop can influence both your metabolism and your reproductive cycle. Understanding it changes how the entire condition makes sense. Stay with me. Insulin is a hormone made by your pancreas. It helps move glucose from your blood into cells. Your cells use that glucose for energy. Insulin resistance means cells do not respond to insulin normally. Your pancreas may compensate by producing more insulin. In some women with PCOS, higher insulin levels can encourage the ovaries to produce more androgens. Those androgens can further disrupt follicle development and ovulation. This creates a difficult feedback loop. More than half of women with PCOS have insulin resistance. However, not every woman with PCOS has it. Insulin resistance can occur at different body sizes. It cannot be diagnosed by appearance. Over time, it may raise the risk of prediabetes and type 2 diabetes. PCOS is also associated with blood pressure, cholesterol, sleep, and mental health concerns. That does not mean every woman will develop every condition. It means appropriate monitoring matters. Some women develop thick, dark, velvety skin patches. These may appear around the neck, underarms, or other folds. This change is called acanthosis nigricans and can be associated with insulin resistance. Others notice increased hunger, fatigue, or difficulty managing weight. Those symptoms are not specific enough to diagnose PCOS. A healthcare professional can decide which blood sugar, cholesterol, hormone, or other tests are appropriate for you. PCOS deserves whole-body care, not only an ultrasound of the ovaries. Most people believe PCOS always means many ovarian cysts. But the truth is actually that some women meet diagnostic criteria without that ultrasound appearance. Most people believe PCOS affects only women with obesity. But the truth is actually that PCOS can occur at any body size. Weight alone cannot confirm or exclude it. Most people believe irregular periods are harmless, but the truth is actually that very infrequent periods can allow the uterine lining to remain exposed to hormonal stimulation. Your provider may recommend treatment to protect that lining. Most people believe PCOS makes pregnancy impossible. But the truth is actually that many women with PCOS become pregnant. Some conceive without fertility treatment. Others benefit from treatments that support ovulation. Most people believe one supplement, restrictive diet, or social media remedy can cure PCOS. But the truth is actually that there is currently no single cure. Symptoms can often be managed through individualized care. Treatment may address menstrual regularity, acne, excess hair, insulin resistance, fertility, or long-term health risks. The right plan depends on your symptoms and goals. Most people believe medication means you have failed. But the truth is actually that medication can be one useful part of evidence-based care. Hormonal contraception, insulin-sensitizing medicine, anti-androgen treatment, fertility medication, and skin or hair treatments each have different purposes and risks. They are not interchangeable. Never use someone else's prescription or stop prescribed treatment based on a viral video. Now, let us turn this information into 5 practical actions. Before the 5 steps, remember this: PCOS is not your fault. Your symptoms are not a moral failure. You deserve respectful, individualized health care. Here are 5 things every woman should know about PCOS. Number 1, track your menstrual cycles. Record bleeding, skipped periods, acne, hair changes, and other symptoms. Number 2, request a complete evaluation. PCOS diagnosis may involve history, examination, blood tests, and sometimes ultrasound. Number 3, discuss metabolic screening. Ask whether blood pressure, blood sugar, and cholesterol checks are appropriate. Number 4, choose sustainable health habits. Regular movement, balanced nutrition, adequate sleep, and mental health support can benefit overall well-being. Avoid extreme promises and punishment-based plans. Number 5, make treatment match your goals. Managing periods, protecting the uterine lining, improving symptoms, and planning pregnancy may require different approaches. Speak with a qualified healthcare professional about your individual benefits and risks. Now you know exactly how PCOS can connect your ovaries, hormones, ovulation, insulin, skin, hair, fertility, and long-term health. The human body is truly incredible. My name is Dr. Chloe Anderson, and every single week I explain exactly what is happening inside your body using 3D animation and real science that finally makes sense. If this video helped you understand something you never understood before, please hit that subscribe button right now. Drop your biggest question about PCOS in the comments below. I read every single comment. Remember, this video is general education. Personal symptoms require evaluation by a qualified healthcare professional. I will see you in the next video.